Good evening and welcome to Doctors on Call. I'm Dr. Peter Nalin, Professor and Head of the Department of Family Medicine and Biobehavioral Health and Associate Dean for Rural Medicine at the University of Minnesota Medical School, Duluth campus. I am your host for our program tonight on infectious disease and immunizations. The success of this program is very dependent on you, the viewer. So please call in your questions or email them to ask@wdse.org. The telephone numbers can be found at the bottom of your screen. Our panelists this evening include Dr. Ken Ripp, a family medicine physician with the CMH Raiter Clinic in Cloquet. Dr. Harmony Tyner, an infectious disease specialist with St. Luke's Infectious Disease Associates. And Dr. Dylan Wyatt, a St. Luke's emergency medicine physician. Our medical students answering the phones tonight are Walker Lair from Monticello, Minnesota, and Nehemiah Olson from International Falls, Minnesota. And now on to tonight's program on infectious disease and immunizations. Dr. Ripp, the first question is for you, and that's about the importance of pertussis in the tetanus booster for adults. Why is it there?
What we found is that for adults it's important to keep up on your pertussis because as you get older you can get very sick from it. We found that patients who end up in the ICU with bad pneumonias, there's a percentage of them had pertussis, and we didn't really think, we thought of it more as a young person disease. And so by vaccinating the whole population we can just sort of keep it tamped down. A teenager getting pertussis, they can get very sick too, and so now we boost them at around 7th grade, and that helps protect them into adulthood, and then continuing to keep that protection is a great idea.
Thank you. Dr. Tyner, congratulations to you for the recent publication of your research in JAMA, the Journal of the American Medical Association, with your research involving more than 1,000 participants. Can you tell us a little about why this research was undertaken and what it's shown?
Yeah, so we've been lucky enough to work with the CDC on a prospective cohort study, which means we've watched about 7,000 people across the country over time since the beginning of the pandemic. And this most recent research was looking at the effect of vaccination on preventing the different strains of COVID. As you may have heard, there's different types of COVID, so Delta and Omicron. And we observed that the vaccination was able to reduce the degree of symptoms for each variant. The effect was a little less in Omicron, which really kind of brings home the importance of this new bivalent vaccine, which has a specific component of it which is more effective against Omicron. But we are still recruiting, so if you are a frontline worker or someone who works with people face-to-face, we would love to have you consider swabbing your nose every week for us.
Terrific. Well, Dr. Wyatt, for you, we're hearing the initials RSV. What is it and why is it important in this season in your emergency practice?
Well, it's a respiratory syncytial virus. On any normal year, it would be something that we just call a cold or something like that colloquially, but it is more specifically a respiratory infection that really can hit younger children and the very elderly quite hard. This year, from what we have seen throughout the rest of the country, and even now down into the cities, the levels of RSV we're seeing in the population is quite high, and we're also now in our emergency room starting to see increasing levels of it in more what I would describe as sort of socially mobile kids, the 3 to 7-year-olds that are kind of out and about and interacting with more people throughout school. They usually do quite well with it, but the problem is that they can then pass it on to younger and younger children. Less than 2 and then less than 6 months are associated with a lot more severe disease. And so we want to make sure we can try and keep it away from those kiddos if we can.
If you're offering an RSV test to a patient or talking to the family, how do you describe the test to them?
Previously, before COVID, it was a little more challenging about we need to swab your nose. Why are you putting something into my nose? But now we're all fairly familiar with the idea of a swabbing test for that. And thankfully, there's actually testing that exists for both COVID, flu, and RSV. So we've been utilizing that a great deal because the symptoms can overlap. And sometimes, especially in a little bit older kids, it can be harder to really identify, yes, this is COVID, yes, this is RSV, purely based on symptoms due to the overlap.
Thank you. Dr. Tyner, A caller wants to know, what is the most common infectious disease you see or treat in your practice?
Most common. Oh, that's such a good question. We see everything. The variety is what makes it so much fun and so interesting. But I think the most common things are common, and I think the most often things we see are bacterial infections and viral infections, but we aren't often called for viral infections unless it's HIV or hepatitis C. Probably staph or strep infections. And staph and strep are the two #1 germs that cause a lot of skin infections, lung infections, bone and joint infections. So I think that's the most common, but there is such a great variety.
Thank you. Dr. Ripp, a viewer wants to know, what's the best way to minimize side effects after an immunization?
That's a good. We used to tell people to, pre-medicate with something before the shot, and we realized that blunts the immune response. And our whole idea of giving a shot is to get your immune system to recognize a virus, or so that if it sees it, it kills it quickly. And if you get a sore arm or feel a little under the weather after a shot, that means that your body's doing what it's supposed to do, which is having that immune response, and so you're generating a good immune response to that vaccine. If you're having those feelings, then you could use some Tylenol or ibuprofen to try and lessen those. But you don't want to take it before the shot. You want to have a clean slate so that your body can generate a nice immune response.
Thank you. Dr. Wyatt, in the emergency practice, do you see travelers with illnesses? And what are some of the common infectious illnesses that travelers encounter?
So here in Duluth, not as much. Where I did my residency in New York, far more so, to the point of COVID very early on, which was a new thing at that point. Here, it's more of those sort of respiratory illnesses, and RSV, flu, COVID, that usually it's someone on a flight from somewhere else. They may be from Duluth, traveled somewhere and came back, and they just picked that up on the flight. The most common thing that we'll see.
Can I interject that infectious disease actually has a travel clinic? So we actually see return travelers who've gone strange places and come back with really weird things. So we've actually seen dengue and hookworm and other fascinating things.
Do you see patients in the travel clinic before they travel?
Yes. So we give them a lot of recommendations about vaccinations to get. If you need to have yellow fever or Japanese encephalitis vaccination, we'll give recommendations on that specific to where you're traveling, and also things to avoid. For example, drink bottled water, or wear masks, or other things that wouldn't make a whole lot of sense, but like altitude sickness. A lot of different things you wouldn't necessarily think about, and like emailing yourself a copy of your passport so you have access to the internet and you don't just have a copy that's lost somewhere. So, practical things too. But
thank you. And Dr. Ripp, the meningitis vaccine, is it working? Is it reducing the incidence of meningitis?
Yeah, that's what we're seeing. Yes, so we're now routinely vaccinating at the 7th grade and before graduation of high school. We try and get our high schoolers vaccinated as they begin to go out in the world and mingle with other adults, young adults. That's when we see these little outbreaks of meningitis. And if we can capture those people, we have seen a decreased rate of meningitis. And there's now a second meningitis shot as well. So
that's very encouraging. Dr. Tyner, what are some instances when you might actually consult to stop antibiotics rather than to start them?
That's such a great question. So oftentimes when people are admitted to the hospital, they're sick. And one of the things that can cause the greatest risk of morbidity or mortality, dying or being really sick from something, is oftentimes an infection. And sometimes it ends up being something else, for example, congestive heart failure or a stroke or something else, but it's not obvious at the time. So as we go through the workup, sometimes it ends up not being an infection, even though we oftentimes will use antibiotics to start with just to be careful and just to be sure. But oftentimes we can pull those back if we've kind of ruled it out or ruled something else in.
Okay.
As someone, if I can just add on, as someone who is often the prescriber of many of those broad-spectrum antibiotics, especially in people who are very, very sick, a lot of the markers that we would use for infection, such as white blood cell counts, can be elevated in any kind of stress. And so those can seem falsely elevated. We can have symptoms just due to general severe illness that can imitate those kind of infectious processes, or perhaps there is a small infection going on, but it's not the main problem, and one that needs to be addressed with the suite of a sort of larger, stronger set of antibiotics that we often utilize in the ER.
Mm-hmm. You have heard of the news stories of floods and people being sick after hurricanes, et cetera. What's your advice or alertness about the flesh-eating bacteria? What are you looking for in patients who may be concerned about this?
You just cheered. You should take this one.
So flesh-eating bacteria. So in hurricanes, it's unique because they oftentimes have exposure to certain pathogens we don't necessarily have here. So Vibrio vulnificus is one example of things that can cause the quote-unquote flesh-eating bacteria. But here's something that's interesting, and maybe I don't want to worry anybody, but most bacteria can eat flesh. But not in the traditional sense, like the really rapid ones. If people are concerned about that, there's really two types of things we think about. There is necrotizing fasciitis, and it's usually caused by one of two things. One is either you get a wound and you have a history of diabetes, and that can cause a really terrible looking wound, or group A strep, the strep throat germ. If you have a very sore spot on your body or you're feeling sick, that's something that can be assessed for, and there's pretty classic things we look for. But I wouldn't necessarily be worried about the classic flesh-eating bacteria. It's not really that common, generally speaking.
Thank you. Dr. Ripp, a viewer from Proctor wants to know, after enduring viral pneumonia for about 2 weeks, what might be the next things to consider?
So are they still sick?
Yes, I think so.
So if you have a viral pneumonia, it can damage the lung tissue, and then you can get what's called a superinfection, meaning you can get a bacterial infection that is able to then break in and start a different kind of infection. So if they're still sick, you need to go back in, because sometimes we do say, okay, it was virus, now it looks like it's moved on to a bacterial pneumonia, and you might need antibiotics. So,
okay. Thank you. Dr. Tyner, a caller from Tower, Minnesota wants to know, what are some of the negative side effects of the COVID vaccine to watch for?
The COVID vaccine is very similar to other vaccines. We really haven't seen a lot of severe side effects overall out of proportion to any other vaccine, and those are usually soreness at the injection site. Sometimes people will have a fever afterwards for 24 to 48 hours, and sometimes you'll have muscle aches and joint pains. But those things are usually pretty brief. Rarely people can be getting sick at the point of time where they get a vaccine, and kind of it might seem like that's making them sick, but really no different than any other vaccine. So if you get a flu shot or a polio vaccine, like anything that you would get can cause the same types of symptoms.
Okay, so most are asymptomatic.
Or have symptoms for 24 hours that rapidly resolve. Yes.
Okay, thank you. Dr. Wyatt, if a patient presents suspecting that they've had a spider bite, how might that be related to an infectious disease presentation?
That's a fascinating and fantastic question. So a bit rarer in our area, spider bites, but as during the summers, there can certainly be incidences where we encounter spiders and can have bites. Usually the spider bite itself, depending on the spider variety, most spiders are not venomous, even if they do bite, and if they are venomous, they don't cause a lot of damage. Usually in those cases, what will actually cause the swelling, the injury, and the sort of redness around a potential bite is a superimposed bacterial infection from the bacteria that live on your skin. The normal bacteria that are in our environment and on our skin are then put into a place where they shouldn't be under the skin from the bite itself. If there's any concern about that, of big red swelling areas, I'd encourage people to come and get it double checked on, because it can be a little tough to differentiate between if it's just the bite or if it's a bacterial infection sometimes.
Dr. Ripp, besides COVID, what are some other infectious diseases you wish the public knew more about? This caller wants to know.
Common things are common. So influenza, so now if you haven't gotten it yet, go get your flu shot, because we're trying to get everyone protected. And we look to our south, like Australia's having a very difficult time with influenza, and it's going to come our way. It's already in the southern United States, and it's going to come our way. And so now's the time to get protected. Tetanus shot. And then if you're of the right age or have the right diseases, pneumococcal vaccination. The curve that we were able to show when we started to vaccinate with pneumococcus, we've just been able to really radically reduce the number of pneumococcal cases that we see by vaccination. Our hospitals don't have the patients with pneumonia like we used to 30 years ago because of pneumococcal vaccination. So go into your primary care doctor, make sure your vaccines are up to date.
Thank you. Dr. Tyner, if a patient is sick in the hospital and offered a flu or pneumonia vaccine, should they get it?
Depends on what they're sick with. If they're there with a broken ankle, yes. If they're there with something else that's causing similar symptoms to what the vaccine could cause, I would wait until they're better. So if you're there with an infection, I would wait till the infection has resolved. Generally speaking, there are some exceptions, but generally speaking, I'd wait till you're better.
Another question from a viewer, Dr. Wyatt. We hear about antimicrobial resistance. Is this something the public should be worried about?
Worried, no. Cognizant of, yes. It is something that is a sort of steadily building concern in that anytime someone takes an antibiotic, the goal is to eradicate a bad bacteria. If one does not complete the course of antibiotics, which is a very common reason why this resistance is growing, or if there are some other factors involved, that bacteria can sort of put up defenses against those bacteria, the antibiotics. From the public's perspective, what they need to be concerned about is just making sure you take the entirety of your course of antibiotics. And generally speaking, when you are taking an antibiotic and afterwards, try to take some kind of probiotic supplement as well that can reduce the risk of those kinds of bacterial infections.
Thank you. Dr. Wyatt, this question is about, or pardon me, Dr. Tyner, this question is about monkeypox and why it's particularly severe in critically ill patients in the critical care units.
Why monkeypox is worse in critically ill patients.
Or is it worse in critically ill patients?
I don't know that it is worse. So the vast majority, so monkeypox itself is an infection that's transmitted by contact. It's not one that's, it's not a respiratory transmission, et cetera. It's transmitted by contact. At this moment, in this current outbreak of monkeypox, it is primarily seen in people who have had sexual contact and largely in our population of men who have sex with men. That's not exclusively there, but the vast majority, well over 90%, that's the case. I have not yet seen those people in the ICU, but there is a chance that those infections could make them sick enough to be in the ICU. It's unlikely you'll get that infection while in the ICU. So I would say if you are at risk of getting monkeypox for the reasons described, there is an effective vaccine out there, and I recommend seeing your provider for it.
Okay, thank you for that. And Dr. Ripp, is there actually a diagnosis or workup called fever of unknown origin?
Yes, and that's when I would be calling Dr. Tyner. So occasionally we'll run to a patient who just has a fever, and it can be just a spiking fever daily or every few days, and they just get this high fever, or there'll be a consistent fever, and the primary care doctor or the ER doctors looked at the common causes, and we can't find a cause, and a lot of times that's when we call Dr. Tyner up and we say, boy, we got a great case for you. And sometimes they'll do a huge workup and they'll find something very exotic. I had one gentleman who had brewer's yeast.
Oh, so cool.
And then I had another friend of mine who we worked up, and we could never find a cause and just went away.
Interesting. Dr. Tyner, suppose you're evaluating a patient with a wound on their ankle and it's just not healing. Could it be infectious, or how might you approach it?
Yeah, it could be infectious. I will say that by the time I usually see somebody, they've usually had multiple courses of antibiotics, and there's usually other risk factors. Whenever I see a non-healing wound, I usually think about underlying infection, possibly infection of the bone. However, I would say the vast majority of non-healing wounds tend to be related to circulation, whether it's venous circulation, or swollen legs, or simply not having enough blood flow in arterial circulation. So I would be really thinking hard about their circulation.
Dr. Wyatt, is COVID increasing the incidence of lung disease?
Is COVID increasing the incidence of lung disease? In the so COVID infections have been associated with an increase in lung damage. I have not seen any research specifically about increased incidences of asthma or things of that nature. There certainly has been, I believe it was a few months ago, a study that showed a decreased oxygenating and kind of like a vital capacity, the ability of the body to really get in full amount of air and oxygen in people post-COVID infection, and that can last for quite a while. You've heard of long COVID. That could be one of the symptoms of that. But I haven't specifically heard. Have you heard of that? Any increase in asthma? Anything of that nature?
I've heard a lot of it increased a lot of things like the cardiovascular disease, but
Right.
Specifically lung disease. I know there's could be scarring, but not anything else unique. Have you heard of anything?
There was a study that looked, and they did PET scans on people post-COVID, and they could find microscopic circulation issues, so probably tiny blood clots in the
Oh, sure.
lungs. And so if you talk to athletes who have had it, a lot of times there is this prolonged recovery, and then they
Right.
get back. So that's a good, if you're, that's why I encourage younger people, especially all younger people, but a lot of parents don't think that their kids, they don't need that COVID shot, but if they're in sports, they want to be active, it is protective of the lungs and all the rest of the body, so.
And I will say, we don't know yet. We still truly do not know yet in the long term, right? COVID's been here for 2-3 years, and
Not that long.
it could be that there are issues in the long term. And from what we've seen thus far, a lot of the issues we know about are mitigated to a significant degree by the vaccination.
Right.
Would one of you begin talking about the effectiveness of the newest COVID booster, and then others could chime in.
Well, we know that the newest COVID booster has increased efficacy against the currently circulating strains, which are kind of known as Omicron. The old vaccine had some activity, but it really wasn't robust against Omicron. And the new vaccine really does have much better activity against Omicron. Again, we'll always know more after the fact, but right now it seems like that's the best thing to do to protect yourself.
Okay, and this is about vaccinations and timing. We have a few questions about that. I'll start with this one from a caller in Duluth. Why do we often get 2 vaccines at the same time? Is there any benefit to spacing them out?
If you give, we see this a lot in kids, where we know that we can give multiple vaccines at the same time and they'll all work if they're given at the same time. Now, if you give one vaccine and then you give a vaccine a week later, that second vaccine might not work as well. So that's why we have that spread between vaccines. So if you're getting shots, multiple shots at the same time, it works. But if not, you need to give I tell people, a 6 to 8 weeks between the shots. So, because giving vaccines are complicated now, because some shots you can get in the clinic and some you have to go to the pharmacy now, and so it's a little bit messy for certain vaccines, at least in my world.
I think there's also a practical component as well of just the lesser amount of times that you're having to go to a place, come in, get the alcohol swab put in there, and actually get the shot. And then, of course, the period afterwards where you're sort of recovering from there.
From Cloquet, a caller asks, I've had COVID. Do I wait 2 months for my flu shot?
For your flu shot?
No, I would go for it.
As soon as you feel better, go for it. There is some data from the CDC if you've had COVID to wait 3 months for your COVID shot, and that's just thought to give you an increased boost of antibodies. However, it's not dangerous to get your COVID shot sooner. I would recommend waiting until you've recovered. They say about 10 days till you recover from your COVID infection, but there's no harm in getting it right after you're infected.
And Dr. Wyatt, besides the tetanus shots that you might prescribe in the emergency room, are there any other immunizations that you offer in the emergency room setting?
Tetanus is the most commonly given one. For a long time, we were also doing COVID vaccines for anyone who had a hard time getting there or who was like, you know what, I'm here for a different reason, but I'm ready, let's do it. I believe those are the 2 that we have available. Oh yes, of course, and rabies, although when it comes to, that can get a bit complicated if people are having a bite that's confirmed from different kinds of animals, but we do rabies as well.
Okay, and a quick question. How might antibiotics help acne?
So, as the teenage skin changes from thin skin to thicker skin, the pores get longer. There's certain bacteria that then start to develop under the skin, and the antibiotics can help lower that count of bacteria under the skin. And also, many of the antibiotics we use have natural anti-inflammatories to them, so it takes some of the inflammation out of the skin as well.
Okay, and then briefly, should a caller be concerned about whether they do or don't have symptoms after a COVID vaccine?
No. Nope. It seems like you develop a reaction even if you don't have symptoms afterwards. It's just some people experience that more systemic symptom, but it seems like you still have antibodies if you didn't have symptoms after your vaccine.
And then another quick question, Dr. Ripp, the pneumonia shot, who gets it and when?
Anyone over 65 should get a pneumonia shot. If you are under 65 and have certain disease states, so diabetics, bad lung diseases, patients who have chronic medical illness, heart disease, should talk to the doctor about getting a pneumonia shot. And there's now there's some new pneumonia shots that are even better.
Well, I want to thank you all for a very interesting and rapid round of active questions from our viewers. I'd like to thank our panelists, Dr. Ken Ripp, Dr. Harmony Tyner, and Dr. Dylan Wyatt, and our medical student volunteers, Walker Lair, Connor Olson, and Nehemiah Olson. Please join Dr. Mary Owen next week for a program on stroke and other neurologic problems when her panelists will be Dr. Erica Kuhn, Dr. Vikram Jadhav, and Dr. Jonathan Schultz. Thank you for watching. Good night.